We all have a desire to live longer, better, and healthier lives. Today, we can achieve this by listening to the quiet machinery of our bodies in ways that previous generations could never have imagined. But as we look inward, it's easy to forget the ecosystems around us, the cradle of life that makes our very existence possible. It's time to realize that longevity is not just defined by advances in medicine. It's intimately tied to how we heal, protect, and remain in balance with the planet that sustains us. For most of human history, health was something we fought for simply to survive. In the 1800s, the average life expectancy was just 30 years. Today, the balance has shifted. Health and wellness is something we cultivate, and medicine is becoming a tool of prevention rather than cure. But we still have a long way to go. Mental health challenges impact 15% of young people. Non-communicative diseases, such as heart disease, cancer, and diabetes, cause 74% of global deaths. And by 2050, dementia could impact 153 million people worldwide. If we tackle these challenges, global life expectancy could rise to an average of 77.4 years by 2052. But that future is only possible if the planet that sustains us remains healthy too.
I'm Dr. Elodie Freiman. Brown University is my affiliation. I think that we humans have this false notion that we're the only animals on this planet that use medicine, and we're so incorrect about that. Animals throughout the animal kingdom use medicine, and they're actually really skilled self-medicators. They're able to find medicinal plants, even insects, fungus, that they're able to then use for their own well-being. And they're also not only able to care for themselves, but also extend that care to others. There's so much traditional ecological knowledge, anecdotes and stories and folklore of animals using medicine, and people subsequently learning from animals about the medicines in their landscape and their ecosystems. In many cases, those medicinal resources are under threat from anthropogenic disturbances that we're causing. So it's really important that we continue this work, we continue studying how animals are interacting with the medicinal resources around them, so that we can better protect those medicinal resources in the future and make sure that not only we maintain access to our medicines, but also animals maintain access to their medicines as well.
Humanity's health doesn't exist in isolation. It is biologically bound to the health of our ecology. Today, over 2 billion people lack access to safe drinking water, and almost half the world lacks proper sanitation. Air pollution, drought, and climate pressures are already pushing 132 million people into extreme poverty. So it is time for us to embrace a radically expanded idea of health. One that includes the air that circulates through our lungs, the soil that grows our food, and the infrastructure that connects us.
My name is Tina Woods. I'm affiliated with the International Institute of Longevity. We are now actually understanding that the major drivers of poor health are actually things like air quality, the quality of how we move in our environments, the food that we eat. If we walked even 20 minutes a day, it would have a major impact on transportation policy, a major impact on our health. We'd start to look at the future of mobility and transportation very, very differently. We'd start to encourage walking more. So the relationship between human and planetary health is extremely strong and interconnected. Our proximity to nature, access to green spaces, has a huge positive bearing on our health. So this is absolutely how we need to be thinking to influence the big shifts in government policy making, investment, business, but also the wider public, to focus on health as an asset. Where do we need to invest in health to get the payoff, the return on keeping healthy and well for as long as possible?
For the first time in human history, we are beginning to see the emergence of tools and technologies capable of delivering a truly integrated vision for human health. Because our health doesn't end at the boundary of our skin. It extends into the world and surrounds us. Beyond the body, climate-smart innovations minimize environmental risks and restore the ecosystems we depend on. Technology will allow us to care for ourselves and our planet in new ways, shaped by science and sustained by nature. Personalized medicine meets planetary stewardship. If we want to heal ourselves, we must heal the planet that makes our lives possible.